Well, I show it's 4:16, and I think we have a quorum, so we'll call the meeting to order. The first item of business, we'd like to move number 10 on the agenda up to, let's do it as number 4 after public comments. We're going to get some corp counsel on the line to make some comments about that, and so we'd like to move that up, item number 10 up to item number 4, and then just move everything down below that if we could do that. If someone would care to make that a motion.
So move.
I'll second it. Laura Negro.
Laura Cruz, Laura Negro. That is. That's
Okay.
The Laura's have it.
The Laura's have it.
All those in favor of moving that on the agenda signify by saying aye.
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 Opposed? Motion carries. Next item on the agenda is approval of the minutes of the last meeting.
Make a motion to approve. Second.
There was a motion and a second to approve. I think it was Laura and
Negro. Yep.
All those in favor?
Aye.
Aye.
Opposed? Motion carries. Any public comments? Anyone from the public on the line who wishes to make comments to the board? Hearing none, we'll move on then, and we'll bring up the resolution of racism as a public health crisis.
So this is Terry Barningham. This was asked to be put on the agenda by Laura Negro. I believe it was presented at, was it WCA, Laura?
This is something that came down through the state. We've had quite a few counties that have passed things like this, and cities too, especially because we have a reasonable amount of people of color with our tribal groups in our area, and it just racism is another stressor on people of color, and it not only does COVID-19 hit them, but also the stress, and it just, we need to say something, and this is definitely a good step forward.
Maybe we should have a motion to adopt the resolution, and then we can go into discussion.
Okay.
So moved.
I'll second.
Okay, motion made and seconded. Now we'll go into discussion.
Okay, we're just, this is Clark, by the way. We're just, Max Lindsay was just in the courthouse, and so he is just logging on. And he has some comments concerning this type of resolution. And do you want to use the headset and talk here?
Hello.
Hey, Max.
Hi, Max.
Sorry, I'm a couple minutes late here. I was up in the courtroom. So clerk just asked me to review this and this resolution. And I guess there's no specific legal prohibition to this, but in discussing these, it's always just my thought on any type of symbolic resolution is to look at what we're trying to do and what the benefit versus the potential risks are. Whenever we have a symbolic resolution, there's always a risk of alienating someone. And then you have to weigh that versus what is the actual benefit here. So again, my position on symbolic resolutions has nothing to do with what the actual underlying cause is. I think everyone can agree that racism is bad. That's not a dispute, but taking a certain position without a definite action or requirement as a result of that resolution just, in my mind, risks those alienating some people. If we have certain programs, certain initiatives, certain items that would want to be acted on, those then go into some more action resolutions rather than just a symbolic resolution. Another, just if we do have and decide we do want to go forward with any symbolic resolutions, I know we put in a lot of, in the whereas clauses, these all make good points here. But again, it's just, if we can cite to those studies or cite to certain actual facts, that would add some credence to any of these types of actions too. So again, I just not saying that there's no potential legal liability for passing this, but something that has to be looked at.
Max, who are you worried about us alienating with this?
I don't know about this specific one. I just see the last one. Be it further resolved, federal initiatives that advance social justice. There are some groups that view that as favoring certain communities, just like I personally don't think that saying Black Lives Matter alienates anyone or should alienate anyone, but people are offended by that statement. Certain people are offended by racial justice programs because I know the intent is good, but there are certain people who don't view that as there being an injustice issue. And again, with this, it's not specifically this resolution. It's all these types of symbolic resolutions. What's the benefit that's going to come from passing this resolution? What specific action is the county going to do that is benefited from this resolution?
I suppose that question kind of falls on me. Why I think we need to do this is we do need to make the statement in our community that this is not only just a social justice issue, but it is also a public health crisis for the people who are of color in our county. This gives us also an option to, as on my other hat as Chair of Public Property and Law Enforcement, we are going through different pieces of race, social justice and implications with our people of color. It's time we talk about this. And as for never passing any resolutions that are symbolic, which the original one does have like the studies also linked on the bottom. But if we never pass anything that ruffles anybody's feathers, we'll never pass another budget. We'll never pass another anything because something ruffles somebody's feathers sometime. And I think we need to take a stand up here and make sure that our population knows that we take this seriously.
So I guess with that, yes, the budget ruffles feathers, but it accomplishes setting forth the spending goal. I would be, if you had a specific initiative, like whereas the county was seeking to support this program or commit certain funding to this program, those show your position rather than just stating in general we're supporting this. And again, it's not this specific issue. It's just a trying to keep resolutions to actual action items rather than ideas.
I guess I could jump in, Laura and Max, if that's okay.
Yeah,
you know, that
right ahead.
I would say, you know, we're asking the larger county board to support initiatives of this nature, and when a resolution then comes to the full county board, and take that line 5 issue from January, which has a clear social justice implication. then the County Health and Human Services Board has weighed in on that and given some guidance that board members can say, you know, have we thought about the social justice implications of this? And if we haven't, we should. Our colleagues on the Health and Human Services Board have asked us to do so. So I don't know that it's just symbolic.
So how about then we put something in that any type of funding or allocation or something like that must take into consideration issues of racism and so racial justice in that, to require some action, I think. If that's what you're looking for, if that's the purpose of this, then why not come out and say it, is what I'm saying, I guess.
So you would recommend waiting on this and putting some more in, or amending it now?
I am not going to take, I guess, a policy position. I just want to make clear what I view these symbolic resolutions as. If you have an end game, like Matt said, if you want every county decision to specifically consider racial justice, or then come out and say it, if that's what you're looking to do. Otherwise, this is just another piece of paper out there that has no weight. Yes, it's showing somewhat of a desire, but it's not making any requirement. It's not specifically identifying anything.
Okay, point taken.
And I'm not in a position, like I said, this isn't going to subject the county to any legal liability, so I'm not taking a position one way or the other on this. Just giving my 2 cents on the whole issue of symbolic resolutions.
Okay.
Anyone else have any questions?
This is Laura Cruz. Partly, I just find it interesting that we've done some symbolic resolutions, and this is the first time that I'm aware that Max, that you've put given us input on this. And so I don't know if it's because we have and this isn't about you personally, but because we've been passing symbolic resolutions a lot recently, or I mean, I do really think that I like the idea of putting some teeth in it, because I think that, one of the issues related to racism is non-native, non-people of color may do the whereas and whenceforth and all those, and then there isn't any action behind it, and so it becomes hollow words. And I don't think that's the message that we want to put out there. I think that it is important that our county start looking at the public health issue aspect of it, and more than that. But there's I mean, the human dimension of the impact of racism, the health factors, the ACEs scores that I think that has been discussed in our meetings before. These all truly are health impacts and economic impacts. And I think that given some of the actions that have happened in our own county as well as throughout the country, I think it is really important that our county make a stand. And if we don't, then I think we find out who doesn't believe that there's an issue, which is just as important. And so I don't know that, passing it today without any teeth would necessarily be the best thing. But I don't want this to be put off to just be tabled forever. Thank you.
Keller here. I'd like to just say I agree with Matt. I think the idea of making a statement is a little hollow without some specific goal. I also favor motherhood, saluting the flag, being kind to animals, and many things like that. So I just to make a statement without more to go on, I think is, as someone said, hollow. Thanks.
Chairperson, this is Clark Schroeder. Can I be recognized?
Sure, go ahead, Clark.
Thank you. Clark Schroeder, County Administrator. I'm just in another room besides Max here, but you know, I think the most, and I've said this before, you've heard me preach about this for a year now, the most important policy decision that the board makes when they set their priorities is when they set the budget. And I kind of agree that if you're going to make a statement that you're going to try to make an action out of it, you know, first off, what are you going to do with your budget? How are you going to focus on an issue that you see as relevant? And I would concur that I think, you know, it's good to pass resolutions that we should eat vegetables, but frankly, potato chips taste better. And so, you know, and I think those are just messaging things. But to have the board weigh in and say, we feel this is a priority. We feel this is something that's vitally important to the county, and we want to address either in the budget or in, as we do allocations and policies, should there be a review process when we develop policies from the perspective of saying, does this advance or inhibit, you know, racism and behaviors of, you know, economic inequalities, educational, lower incomes? You know, what filter do we want to use when we make decisions? I see this as a good tool to discuss, to say, how should we rate our budgets? How should we rate our policies? How should we rate our basically the administrative state of how things are done? We're not even at the county board level, but at a department level. How do we interact and how do we evaluate things? Do we want to develop a filter that says you need to evaluate it based on some sort of viewpoint? So that's my 2 cents.
Anyone else have any questions or comments?
Tabasha?
Go ahead, Pep.
Yeah, I kind of agree with Dr. Keller here. I would just as soon put it on the table.
Any other comments, questions?
Matt McKenzie has his hand up.
Go ahead, Matt.
*6, Matt.
I see you're muted, Matt.
Can somebody unmute him? There you go, Matt.
We're not hearing you, Matt. I think there might be a connection problem there.
Don't you love electronics?
Think
Is there anybody there?
Dr. Horning has
There,
this.
we heard you there. Try it again. It sounds like you're breaking up badly.
You can hear me. I'm having, and apparently, how's
Try it
that
again.
better? All
Yes.
I agree that we should put some, all right, let me, hold on. Yeah, if you can hear me, I'm having a and identify, can you hear me now? Taking a shotgun blast, I guess is
Go
my
ahead
feelings.
now. Go ahead.
Right, I'll try again. I'm saying what we should do is identify some specific programs and not just take the shotgun blast into the air.
Anyone else?
Yeah, Clarence, Matt Horning.
Yeah, go ahead, Matt.
I guess I'm going to speak to Laura's, I think, point with the resolution, and certainly my comments from earlier. I see real value in this. And if people, whether it's, yeah, I mean, gosh, Clark, if you have a budgeting strategy that can really take into account inequalities and, you know, addressing racism, that's awesome. And we could help the larger county board formalize that. But I think us putting this out there is something, and call it symbolic and, you know, an empty gesture, but I think this is, we can work from this on the next resolution that, yeah, pushes for certain programs, pushes for certain changes within the Health and Human Services Department or the larger county administration. But yeah, I guess I see no reason to say, you know, because this doesn't fundamentally overhaul any like structural racial aspects of the county administration, we should wait on it. I guess I'm prepared to take this and work from this on the next resolution.
I call the question. Laura Cruz.
Okay, there's been a motion to call the question, so we have to vote on whether we want to call the question or continue discussion. All those in favor of calling the question signify by saying aye.
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 All those opposed to calling the question. Okay, now we'll vote on the motion to pass this resolution. All in favor signify by saying aye.
Aye.
Opposed?
Aye.
Aye.
Yeah, maybe we ought to
Can
Roll
you,
call.
take
I
a
think we
roll.
need a
Hello.
roll call.
that we feel we should strive towards making, I guess is my feeling.
Okay.
What did Matt say?
Matt McKenzie? Matt, how do you vote? Well, we'll get back to you. Bill Metzinger. Voting for or against the resolution? You're muted, Bill.
Hit your space bar. Nope, didn't do it.
Oh, geez.
Yes, I'm for it.
Okay, that's a yes. Matt, are you able to unmute yourself?
No.
Okay. No meaning no, no vote, right? Not that you're not able to unmute yourself. Laura Negro.
Aye.
Laura Cruz.
Aye.
Let's see, Matt Horning.
Aye.
Dr. Keller.
No.
Pepe Cabasa.
No.
I vote aye. Let's see, did I get everybody? I think I've got, what's that?
I think so.
think I count 4 ayes and 3 noes. Is that right?
5 and 3.
5 and
I've got-
3.
Wait, no. Yeah, that's right.
Did you get my vote, Clarence?
I thought I did. Pepe, you
Okay, I just didn't know if I can't tell if you can hear me or not, so I just wondered. Thank you.
so I had Matt, Pepe, and Dr. Keller voting no, correct?
Correct.
Correct.
Okay, and myself, the 2 Lauras, Bill, and Matt Horning voting yes. Okay, motion passes.
Thank you, guys. I appreciate it. I think this gives us a platform to take those next steps, and I appreciate your vision on it.
Okay, now we'll move on to the staffing updates.
Okay, this is Terry Barningham, and we don't have too many this time. We did have a new employee for the Public Health Department. Her name is Rebecca Nielsen. She is our new environmental health and emergency preparedness worker. She comes already as a registered sanitarian with lots of experience. So I can't tell you how lucky I feel that we were able to get somebody with her experience and knowledge in these really difficult times with our public health emergency. So we're very happy to be fully staffed in that department again. And in that department also, we had Ellie Webb, who was a limited term employee for the summer. She's currently back in school. She had done some work for us with water testing and helping out with the DNR contract that we had. She has agreed to stay on and do some contact tracing for us. So she's officially not in our agency, but she can do the contact tracing where she is in college. So that's great. She knows how to do it. She had a lot of experience when she was here. And we hired also Colleen Douglas, who is our new children's long-term support and comprehensive community services worker. She will be working with youth who have who are dually enrolled in both of those programs. She comes to us with lots of experience in various agencies working with children and families. So again, very lucky to have such a good candidate. The requirements, especially for the CLTS piece of that, is very specific and requires quite a bit. So very, very happy to have her with us in that capacity. And then we have 2 interns who are working in our mostly in the CCS unit. Sasha Volberg, who I believe is a Northland College student doing her internship with us, and Jordan Cowning, who is a WITC intern with her emphasis on the Human Services Associate program that they have. And I believe that's the update.
Okay, thanks, Terry. We move on to calendar year 2021 budget review and approval.
Hey everybody, this is Pete. That means I'm going to try to share my screen with you here. Let's see. There. Can you see that okay?
Yes. Yep.
Okay, so this is the page. This is just the summary. I made it as big as I could on the screen here of the Health and Human Services proposed budget for 2021. This is just the overview. There is a lot of detail that kind of rolls up into this, and I'm happy to share that with anybody who wants to see it. I think that for purposes of this meeting, that would probably cause more confusion than not. So the bottom line here is that if you see this green box of about $2.2 million, that is our levy request for next year. That levy request is flat relative to 2020. Clark has been talking with the departments around the county about potentially moving some debt costs to debt levy. So this number here, this 38,492, that represents our annual payments on the downtown building that we purchased when New Horizons stopped providing services. And so if that decision is made to move that into debt levy, our total levy request will remain the same. It's just that the general levy request would be reduced to 2169344. So I'm trying to think if Terry, are there big changes to next year? I can't think of any. As always, it's a challenge to the biggest challenge for budgeting for this organization is, as we've talked about 100 times, trying to plan for out-of-home placements. It's almost, it's very difficult. We look back across several years to try to take some sort of a shot at how many people might be placed in kids in out-of-home care, how many people might be ordered to state mental health institutions and other out-of-home placements. That part is very difficult. It impacts the adult services budget, which is the top line, and it impacts the children and family budget, which is the third line down. Again, that's in all of the gory detail, but that is the biggest challenge always in budgeting, and then also trying to manage to that budget. So.
Yeah, I don't foresee us having any really light year with the amount of recent emergency detentions we have and the amount of kids we have in placement, knowing a lot of these placements last up to a year when children have a lot of complex needs. So unfortunately, it's not a quick fix. They do a great job once the kids are in placement, and hopefully they're working really strongly with the family so that when the kids come home, they can stay home. But we're not seeing a different trend going the other way.
Anyone have any questions of Pete or Terry on the budget?
This is Matt McKenzie.
Go ahead,
Can you
Matt.
hear me?
Yep, I can hear you, Matt.
Hello.
Yep.
Hi.
We can hear you.
I guess it wasn't discussed in detail, but I would like to see, if it isn't already planned for, I'd like to see something in the budget set aside for those frontline staff workers of ours who are having to work during the pandemic so that they're recognized for it financially. I would also like to see that, you know, the all employees receive some sort of pay increase too, and I don't want to hear what has been figured into this budget, if anything.
Right now, this budget for compensation is flat from 2020. So there are no increases other than we had a couple of people who had hiring letters that say, that basically have, say, a 1 year or a X number of months, almost a probationary period. And once they successfully meet that, then they, get a raise to the full pay for the position. But we only have a couple of those. And so the vast majority is it's 0%, and I think that's countywide.
I was just going to say, I think Clark has requested that of all county employees that there be no salary increases next year.
So to clarify that, so there's not even CPI?
What's that?
So to clarify, there isn't even a cost of living increase, CPI?
No, right now it's 0%. It's flat.
I guess this is Matt McKenzie. Yeah, what I would like to see is an equal amount of pay increase as is given those that negotiate for a wage this year. So if law enforcement, I believe, is the only ones that have negotiation authority, whatever they should negotiate should also be given to the other employees of Health and Human Services.
Well, I appreciate that, Matt, but at the same time, this is our starting budget, and we are hearing from the different committees that, we'll have to cut a lot more expenses countywide. And so some of the things they're looking at will be a net decrease in salary for staff. If we have to take up to 12 furlough days per employee per month, we're probably looking at a 5% decrease in wages.
This is Laura Negro. Oh, Bill's got his hand up.
I think if you take it from that's what you have, and those are decisions that are made at the county board. And I will not support any budget that does not show an increase in here for our employees.
Bill?
I would like to add that I agree they should get some type of increase, but the county supervisors took away 2 holidays. And I would think that we could restore those 2 holidays at the very least. Did everybody follow that?
Yes.
Laura Negro, did you have a comment? Anyone else have a question or a comment on the budget?
I guess Matt Horning here, if I may.
Sure,
Matt McKenzie, are you proposing we don't vote for this without staff increase?
This is just a preliminary budget, I think. I don't think we're going to be voting on it. Are we?
You would be voting to forward it to the...
Okay, all right.
And to answer your question, if you can hear me, I think I'm unmuted, is yes, I will not support this forward without an increase for our employees.
Clarence, Pete, could you comment on what happens if we don't approve this?
Well, I mean, it's got to go to the finance committee to be incorporated into the full budget. I don't know when that's coming up now pretty soon, because we have to vote on the budget in November, I think.
November 24th.
Peppy, did you have a question or comment?
No, I'm good. Thank you, Claire.
Okay. I see your light was coming on. I thought maybe you had something to say.
Oh, really? I didn't touch my phone or nothing.
You must have breathed into your phone or something.
Hot breath.
Well, this is Terry Barningham. I just wanted to say thank you for the support. We certainly hope that our that our employees at least don't have to take a pay cut. But I kind of feel like this is out of our department heads' hands at this point and will be decided probably at finance and the executive committee. But I agree with you. I think our frontline staff have done a wonderful job. I think they've worked harder than they probably ever had, adapting to all the changes that they've had to do, working from home, adapting to meet the needs through telehealth and different kinds of things that they've done. Of course, all the new responsibilities they've had with contact tracing and the whole public health emergency. It's a very unfortunate thing.
I think one of the reasons that Clark was requested a flat salary status is because he wanted to avoid having to cut employees or having to reduce work hours. And he was hoping that by having no salary increases, that would be a way of avoiding reducing staff or at least reducing hours.
Clarence?
Yes, Laura.
I'm on finance. When we talked about this, it wasn't about not having salary increases. It was trying to keep the budget at a 0% increase.
Oh,
and I know that's a play on words, but it doesn't preclude having any increases. And I know everybody's budgets are tight. It was just, we still have no idea what's going to happen yet with.
I'm sorry, I don't know if anybody can hear, but I cannot hear Laura.
Crap. Can anyone hear me?
I can hear.
Yep, I can hear you.
I can hear you.
Thank you. Anyways, it's supposed to be a 0% budget increase. Playing inside
Is
it
there anybody there?
fine. Okay, I can hear Matt.
Must be on your end, Matt, because we can all hear her.
Right.
Go ahead, Laura.
Figures.
Okay, that's what it was, is a 0% budget increase, and that was so everybody kind of tightened their belts because we don't know what's going to happen with COVID and everything else. So from there, there was no direction to say, don't give anybody increases. And like I said, I know that's a play on words because mixing around and with that budget is, if you're given an increase someplace, you got to decrease another place, but there was no direction to not give anybody any more salary or an increase or a percentage or anything. So
Laura, this is Terry Barnes. We were told directly from Clark that if we put any staff increases in, they would be pulled out at his level. So it was very clear to us for to be even if there were grants that could fund that. So it was made very clear to us we could, and that's from Clark.
well, that wasn't my recollection from anything we had at finance. So
This is
Clark still on here?
Mackenzie.
Go ahead, Matt.
I'd like to make a motion that we approve this budget with a 2% increase across the board for all employees.
Second, Laura Cruz.
Any idea how that will affect the bottom line, Pete?
Let's see. Our, I would say that would be, probably, you could probably safely say that approximately half of our $8 million is compensation, salaries, and benefits and taxes and all that stuff. Probably the salaries themselves. Well, a ceiling would be 2% of that number. So what does that give you? 80,000 or something?
Yep. Yep.
Pretty good sized numbers. That would probably be the ceiling because not everything would increase by 2%, but If you take kind of payroll taxes and salary, that would be a ceiling. But 80,000, and countywide, I seem to remember looking at that. I don't know, last year or even the year before, and it's probably 2+ times that. So countywide, it would be if you went from 0 to 2%, probably 120 to 150,000. I would guess.
This is Terry. If I could just jump in, Clark had at some department head meeting we had a couple weeks ago indicated that it was a 1% increase. Countywide would be about $100,000, and if it was 2% countywide, it would be about $200,000.
Okay, yeah, that makes sense.
I guess I think our employees certainly deserve the increase, but I have a feeling, as Terry said, that if that's put in there, it's going to just be taken back out again anyway. Or other departments are going to, if they get wind of it, they'll try to do the same thing.
Well, at least then this board would make a stand and say, we believe that the employees should have a 2% increase. And if other people take it out, then that's on them. But we've made a stand about what we believe is equitable and important. And perhaps there does need to be a 2% increase for all employees, or 1% or CPI or something. But otherwise, people are losing money, and that doesn't quite seem right either.
I see Clark has returned to his post. Have you heard the conversation that's taken place, Clark?
No, Max and I were talking about basically a civil rights plan and some other issues we have to deal in the county with the Department of Justice. So did you have a question?
We've had some discussion on the budget and the fact that there, in the budget that's been presented to us, that there has been no salary increases in the proposed budget. And Matt McKenzie made a motion that was seconded, I think, by Laura Cruz, to put in a 2% salary increase for all our human services employees. So that's where we are right now. And there's been discussion on what would happen if that took place.
Well, ultimately, I'm responsible to prepare the budget for the Finance Committee, to prepare and send on to the county board. I've been working on the budget for a number of weeks now. We basically, 2 weeks ago, we were $500,000 in the hole. And so I've removed I removed all wages. I removed almost all travel. I've decreased office expenses. I basically am taking all capital expenditures and moving those into debt levy. So I'm increasing debt levy by $500,000 or $600,000 in order to try to get down to a balanced budget. And I'm recommending we take $250,000 out of our bank account to balance the budget for 21. Or I would like the county to pass and institute a wheel tax of $25 a car, which would raise $325,000. I'll be frank, there isn't money for raises. I mean, I am doing all the investigation work. I'm basically either furloughing employees to balance the budget if we have to, or basically increasing healthcare costs for people, which would also negatively affect their income. And so there isn't money to give raises for anybody, and we'll be lucky not to cut salaries or cut wages for people for this. And if we basically take $250,000 out of the bank to balance next year's budget, and the county board does not want to raise any revenue, 22 I would spend the year 21 to resize the government, because I agree with you. We need to, in order to keep employees, we need to give them raises. There's no question about it. We have to get back to trainings and conferences for educational opportunities to keep our staff. But we have to balance the budget. We can't raise more general levy dollars, given that if the county does not want to do a wheel tax, 21 will be a restructuring year. We'll work on trying to figure out how many employees do we need to get rid of overall in the county in order to make it sustainable. And that would obviously affect services. We may not be open 5 days a week anymore. We may have a different service model. So the county is in, as you know, is in dire straits because of the levy limit laws. I basically am proposing to the county for a county a bill that would go to the legislators to basically, which will remove the court systems, district attorneys and court employees from the county levy limit law, so that money could be freed up to pay other county staff and then leave that as a separate levy like the library is. And so these discussions will all be had at the Finance Committee on the 24th at 9 o'clock on Thursday, the 24th. And so I'll be preparing memos and putting on a packet by Friday on hopefully getting a balanced budget. But I will say there is no money for a 2% increase unless you're willing to say, we're going to lay off a bunch of people to pay for that 2% increase. Sorry.
Any other questions or comments on the 2021 budget?
Yeah, this is Matt McKenzie again. And I don't believe that we're in such dire straits that we're going to have to lay people off. And I think it's time to send this up to finance and let them talk about this and bring something that makes sense to the board for the board to decide what we're going to do about taking care of our employees.
That's a procedure.
Any other questions, or are we ready to vote on the issue? And the motion again is that we approve this budget, but with a 2% overall salary increase to employees, and then send that on to the Finance Committee. All those in favor signify by saying aye.
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 Opposed?
Aye.
Aye.
I counted 2 votes against. Is that correct?
3. I didn't get mine in, I don't think.
What is your vote, for or against?
Again,
So I think we've got 3 votes against the motion and 5 in favor. I have Bill, Dr. Keller, and Pepe as voting against. Is that correct?
Yes.
Motion passes then.
And what I'll do basically is I'm going to present the budget, because obviously the budget is prepared by the administrator. I present it to the Finance Committee. I will present this budget as is. I will ask Pete Herlevy to give me the number of what 2% increase would be. And whatever that amount is, the Finance Committee can decide if they want to take that away from other county departments or raise healthcare to pay for that 2%, or take more money out of the bank. I'm just being honest with you, there isn't more money. And our total increase for general levy increase was $23,000 this year. And that doesn't go very far when you have 200 employees. So we'll put in the budget, or we won't put in the budget, but we'll put a separate line item with your motion and that you want to pay the Health and Human Services staff 2% more.
Okay. Next item is the public health update for COVID-19. Liz?
Hello, this is Liz Ott from Public Health. Just a quick update for where we're at for COVID cases. As of today, we did have 4 additional positive cases identified today. I believe that brings us to a total of 55 cases positive as of today, I don't believe we had any new ones after I left the office this afternoon. So we are still working on contact tracing. We spend a good deal of our time with contact tracing, identifying any potential close contacts. We've been working very closely with our partners at Bad River and Red Cliff with the recent outbreaks that have gone on, trying to identify everybody and make sure that everyone is following quarantine and any isolation procedures and orders that they would be given. We continue to provide education wherever we can provide education as a means of encouraging people to abide by orders. And in amongst with all of that, we have begun our planning for our flu vaccination clinics. We are still planning to administer flu vaccinations for children in the schools. So we're working with the schools on planning that, kind of taking a look at seeing what that will look like. We did increase our order for flu vaccination for in the schools. Last year, I believe we gave roughly 700 vaccinations for influenza in the school. This year, we have increased the number to 900, hoping that we will have an increased number of students wanting vaccinations. And then taking a look at how we will be setting up our public and community vaccination sites for influenza. The areas where we previously gave those are actually not open for public services essentially this year. So those vaccination sites are going to look quite a bit different related to the restrictions and adjustments because of COVID. I think that about covers it for a brief recap for what we have going on right now.
Anyone have any questions for Liz?
Yes, Liz, Dr. Keller here. Wondering about the high potency flu vaccine for seniors. Will you be administering that?
Yes, we actually did because we had such a large number of requests for the high dose for people aged 65 and older. We did actually order, I believe we have 100 doses of that for this year. I'm not sure if I'll be able to order more at this point in time, but for now we do have 100 doses. We don't have our private flu vaccine stock in yet. I'm hoping it will be delivered sometime this week, it's sounding like. And the nice thing about the high dose flu vaccine this year, in previous years, it was a trivalent, so it contained 3 strands of the virus. This year, it is actually a quadrivalent, so it will contain all 4 strands, the same as the regular flu vaccine.
Oh. Thank you.
Anyone else?
Hey, Liz, Matt Horning. Any thoughts on Ashland County needing an order similar to Bayfield County's large event sort of emergency ban?
There has been some discussion about discussion and consideration into putting in place a large group gathering. However, I don't know that we would have a lot of success enforcing such a thing. I'm just thinking of one example in particular where I've already had a discussion with an event organizer, you know, offering suggestions for things that they could put in place as additional safety measures beyond what they're already planning. And they did question about a order in place for a large group gathering, and asked what the fine was, and essentially told me to go ahead and give them the fine.
Tabasa?
Go ahead, Pappy.
I've noticed who's under the jurisdiction of taking care of like our campsites. I have watched and I don't see anybody governing it or face masks or anything, and they're going to the grocery stores, they're going to the restaurants, they're going all over, and there is absolutely no caution. Who's in charge of that? for the Ashland?
The technically issuing citations for violation for the emergency order number 1 for use of face masks would technically fall to myself. And it is currently essentially a bit of a gray area as a matter of, for example, for businesses, as if a citation would be issued to the business owner, to the employee, to the individual citizen. We're still trying to sort all of that out and figure out how exactly that will all work.
Well, who are we sorting it out with?
Corporation Counsel, isn't it, Liz?
Yep, we've been working with Corp Counsel on it, and we're also waiting. There have been a few other counties that are currently in litigation process because they have issued citations, and these citations have been countered because of who they issued them to. So it's kind of a, as I said, it's a bit of a gray area situation, trying to figure out, as far as, especially when it comes to businesses, for who the individual would actually be receiving the citation, whether it be the business, the employee, the individual citizen.
Yeah, so this is Clark. So basically on the enforcement issue, it's not the law enforcement. It's not the sheriff's department or the city police that would be doing enforcement on the governor's order. And so because of that, you basically have Liz basically by herself. And the question is, would she go out and go to the grocery store or go to, a restaurant, watch people and give them individual citations for not wearing masks? At a certain point, we have to kind of go with, how can we get people to do this voluntarily? We feel it's going to be disruptive to society and create less compliance if we start giving citations to people. One of the aspects that we're watching on the mask is the governor's order for mask expires on September 28th. He had 60 days. It'll be yet to be seen if he's going to extend that for another 60 days. If he does not, we have talked about and looked at drafts for a county order for masks. But again, you have Liz by herself would be enforcing this for the entire county. And we don't know if that would be effective. The last thing I want to do is have the county basically enact a law that we can't enforce. The city, the city has an ordinance already that mandates masks, but the city police will not enforce it. The city has no staff that's going to enforce their ordinance, and they basically are saying it's up to Liz to enforce their ordinance. So it's a sticky wicket.
Well, that sticky wicket is running around town, and what do we say? Maybe they've got it. We don't know if they've been tested, and they're running around in our town. We might as well. I don't see the sense of having everything if we're just going to say, well, that place is having a big gathering, but we're going to overlook it because they're all discussing it. But yet the business ones downtown can't make a move. The churches are closed. Everything, we're doing what we can, and then they're coming in and not helping matters. And I think that gray area has got to be taken care of.
This is Matt McKenzie, and I just would like to clarify one thing. As my understanding and from the city council, that as far as the city police department will issue a citation for not wearing a mask if a business is enforcing a mask policy and a patron comes in and refuses to mask up and
Can't hear you.
We lost you there, Matt.
or know if they've had complaints is obviously going to be complaint driven.
I just made a comment.
Here's the other thing I'd like to say. Yeah, I'm sorry. I'll try and call in.
Okay. I just want to say that I would not want to see Liz standing around in the grocery store writing citations. She can make a lot better use of her time than doing that.
Well, Clarence, I understand that and I agree with you. But it still stands that I see kids down there playing and they're going to go to school tomorrow and all this, that gray matter, and it makes me think everybody's laughing about it. I don't want to see one person, well, figure something out here because they're not complying and we're the ones that are going to suffer and have to pay.
I would just recommend that you assume everybody is positive, you know, and just keep your distance from people. Don't interact with people. Assume everybody you touch is positive.
This is
Any
Liz.
other questions or comments? Liz, did you have something more to add?
Yep, I was just going to comment as far as for businesses for enforcement. If businesses do have customers, patrons, whatever it would happen to be coming into the store that are not wearing a mask and the businesses are requesting that people wear a mask as they come in, if the individual refuses to wear a mask and they refuse to leave the premises, the business is able to contact law enforcement and then law enforcement can, sorry, I was having feedback. Law enforcement can cite the individual for trespassing, potentially disorderly conduct, and a mask violation at that point in time.
I'll just make a comment that my wife works at Walmart and it's posted there that people are supposed to be wearing masks, and I saw people in the store without masks on, and I asked her about it, and she said, well, what they're telling the enforcers or whoever is supposed to be watching that is that they don't want to make a big deal out of it. If people absolutely refuse to wear a mask, they're not going to do anything about it.
I've seen Walmart take people out.
Oh, yeah?
Yeah, it was closer to earlier in the whole thing, but I've seen them escorted out. I'm sure they're having problems. I know at the co-op every day there's somebody that comes in and throws a fit and doesn't want to wear it. So.
Can I try one more time? This is Matt McKenzie.
Go ahead, Matt.
All right. I guess I kind of want to echo what you've already said, Clarence, in that I think we have more important use of Liz's time than to stand and issue citation for masks. And honestly, I think that a citation isn't going to help these matters. And what we have to do is just keep compelling at people's goodwill towards their neighbors. And we're always going to fall a little short of that mark, unfortunately. But that's what's really at stake here is I'm wearing a mask, not for me, but for you. And, you know, hopefully we'll get enough people to do that. But the bottom line is we don't have enough law enforcement to change that if they're not willing to do it on their own. And all we can do is then look at creative ways of identifying those that aren't playing by the rules. And I don't know, maybe we have a Facebook page or something that shows those that aren't doing what they should be doing or something. But we're not going to get into the position of throwing people in jail for not wearing a mask. So that's how I see it. Thank you.
Thanks, Matt. Any other questions or comments?
Too bad we can't give them detention. Nobody likes sitting still anywhere, so.
Liz, Matt Horning again. Is there anything more we can do to help you in your department? I feel like you're kind of bearing the brunt of the load for the whole region.
We've actually reached out to our counterparts in human services, and we've have a handful of people at this point in time that we've cross-trained as far as contact tracing in the anticipation that for flu season, we're going to get a little bit busier. So we do have some backup contact tracers trained at this point in time And that's been working out pretty well so far. So for at the moment, I think we're okay.
Okay, thanks, Liz. It was pointed out to me that I skipped number 6 on the agenda. So we will go back to that. The expenditures to date.
Okay, that is me, and I will share my screen again here. Okay, that's this exhibit. The top, this is year to date through July. This is the exhibit that, this goes by department all the way through. I'm going to focus on this top one, which is Health and Human Services as a whole. So just a couple general trends. One thing to know is we have gotten some funding through the CARES Act at the federal level to help with contact tracing, working on testing sites, some different costs related that are specifically COVID related. So that is going to be has been and it will be very helpful for public health, especially in terms of budget. And in addition, we have some money at the county level too that we will be submitting some costs for, but that's more countywide. The monies we've received are specific to the public health. But that will be a great help for the public health budget specifically, and so for us overall. The other thing I would point out, and Laura Compton may be able to comment on this too, but it appears to me that as always, it's a challenge. Out-of-home placements again. In the children's unit, it appears that we're, Terry Barningham might chime in too, back to a little bit higher levels than we have been recently. So in terms of trends, I would say positive trend is there's a increase in funding for public health. Negative trend, I think, and again, Laura, jump in here, Laura Compton, if I'm missing something, but we have some not record highs or anything, but somewhat high out-of-home placement costs.
I would agree with you. We have a couple long-term people that we are working with the state right now to get out of our IMDs, which is our most expensive placement. Just extremely complex behaviors. We've worked really, really hard to bring in every possible option to try to get them out of those placements and are continuing to work through that to try to get them out. But that's been one of our biggest costs this year. And then with COVID, we have seen an increase in emergency detentions and people that are needing to go to group homes or adult family homes to stabilize for us to be able to bring them back into the community. We continue to work really closely with our CS and CSP programs, which has done a great job of getting people out of those group homes and back to the community quicker, but we've just got a lot of people there that are really struggling.
The other thing I would say, just in terms of pointing out a trend, if you look here at this training and travel line, that is what we would expect in a situation like we have. Our training and travel is, not close to our yearly budget, and we wouldn't expect it to be. So, this number may end up being probably still less than half of our full year budget by the time we're done. So that's a positive, something that's positive in our favor. The only other thing I guess I would point out is that once again, and I talk about this almost every time, and I'll continue to do that. We're 7 months through the year, and we have so far kind of earmarked or used up, for lack of a better term, only about a third of our levy budget that was approved. Remember now that the way our money gets spent is as the year goes on, we spend grant money first as a general rule. And so the second part of the year, this is just about the time of the year when many of our grants kind of we've fully spent them. So the use of these levy dollars will be heavier just in the last 5 months of the year than in the first 7. So again, it's difficult to tell kind of what the net effect will be of the increased COVID funding that we have, and any potential large increases in out-of-home placements. At this moment, I still feel like we should be in the ballpark of that total levy number, which is right here, which is about 2.2 million. And I still feel like as of right now, we should be somewhere in here, but that's kind of difficult to project. So, so some positives from the financial perspective of the COVID situation, if you can look at it that way. But does anybody have questions about any of that stuff? Or
this is Terry. I just wanted to add for the children's unit, since Jenny isn't here. As I discussed before, the out of home placements are very high. They are higher than they were last year. We comparatively had a pretty good year last year, but because of the way people go in and they stay in for up to a year, it just kind of varies on when they enter and when they come out. The one good thing that wasn't really good for us, but I guess budget wise it is, we had looked at we called it the CAN partnership. It was a consortium of several smaller counties who would form a consortium to take child abuse and neglect calls. And we worked all year trying to get that together. We were technically supposed to start in January, so we did have that in the budget, and it never came together, and now they are dissolved. So we do have a little cushion there. I think we put in about 60,000 for that. That will go directly to absorb some of those out-of-home care costs.
Right. Yeah. So it's interesting. And that's why I always present this at a high level for the board. I feel like it's appropriate for, your, kind of executive role. But again, lots and lots and lots of moving parts, even with developing a budget, but certainly with going through and incurring these expenses throughout the year. And so, as I've said many times, if anybody is interested at any point, I'm happy to sit down with people and, go through whatever it is you're interested in seeing in whatever amount of detail. So.
Any questions for Pete? Brighter Future Justice Grant updates. Scott? Is he on the line?
He was thinking he could come. He's actually off work right now, but he thought he would be able to join us, and if not, he was going to have Wyatt come to do a small, short presentation, but I don't see either on right now. Um,
Okay, then we'll move on to continuity of operations in government.
Okay, so that's me. So I just wanted to kind of just update you on where we're at. We always have a continuity of government, continuity of operations plan in place. Typically, it addresses natural disasters and things that would be more infrastructure type situations, so maybe flooding, fire, those kind of things. And most of our plans include sharing with other counties their either office space or technology, you know, helping out each other. We have cooperative agreements with different counties, Bayfield being the main one. We did not, however, really anticipate a pandemic and the different situations that this can cause for continuity of operations. So I've been working with my counterpart in Bayfield County, Pepe Schoolon, Elizabeth Schoolon, to come up with some kind of a cooperative agreement more focused on staffing to help each other out in the event that either one of us loses all of our staffing to you know, mandated quarantine or isolation, those kind of things. So what we thought might be a simple solution to put together an MOU, Memorandum of Understanding, between the two counties got a little complicated because of statutes that require certain counties to, mostly within the children's unit, do their own investigations and all those mandated functions that we do. So we continue to work on that. We're waiting for some guidance from the Department of Children and Families on whether we need specific written approval, how that would. I know Bayfield County at one point had thought it would be a no cost for each county, and I did not agree with that, because for the main fact that there will be costs incurred by either one of our counties, travel being one, so the mileage piece of that, the time that's required to travel to two very large counties, very rural, large counties, and also the staff time that is not budgeted, that if in the event we have to do this, either county could then, for the time that's remaining, put in those expenses for the CARES funding for the Corona Act relief, economic, I don't remember the whole acronym, but it's the CARES funding. So we're just trying to tweak the final details of that. And certainly we want to be good partners and help each other out. So it's just more a formality. So just keeping you up to date on that. Like I said, we've had a really good plan, but it just didn't address this kind of a public health emergency. So we're trying to remedy that.
Any questions? And we'll move on to unit updates. Adult services.
Hey guys, I just wanted to give an update. For the past 5 years, we have had what's called PFS funding for our Chequamegon Coalition on Emerging Drugs. And we are just coming to the end of that cycle. So that is ending on September 30th. And so what we've kind of done at the end to get as much outreach into our community is we were able to purchase a billboard for the entire school year that's going up on Binsfield and Highway 13. Yes. And so that should be going up today or tomorrow. We're running some radio ads that are going on during the day, and then they are also being during the high school football games that are both here. They're announcing them both for the home and away games. And so our messaging about not taking prescription medications is going out at that point in time. We were able to use the funding to order neck gaiters with the Dose of Reality campaign logo on them for all of our school districts across Ashland County. So for kids that don't have access to that, we're able to give those out. And then we were also able to order drug take-back envelopes. And so those are envelopes for anyone with prescription drugs in their home that is not leaving their home to access our drop boxes at our local law enforcement agencies. Can put the meds in there, and then it gets shipped to a specific company so they're disposed of appropriately. We are waiting to hear, there is the possibility of us getting an additional $15,000 for next year for funding towards the coalition. It's at the state level right now, and they have a meeting on Friday, so maybe we will get an update at that point, but keep your fingers crossed for that. And then we will have ongoing access to what's called mini grants, and that goes to specific things. So we're gonna focus on the No Meth campaign. All of our funding has been towards opioids for the past 5 years. And so we'll be able to run some campaigns with No Meth, and then also looking at what's now called Small Talks. That's information about underage drinking. So that's going to be our focus going forward. And that's kind of been on the back burner with COVID going on. So I wanted to bring it back to the forefront that we're still working on prevention in that way.
Thanks, Laura. Any questions for Laura? And we'll move on to community service programs. Val.
Hi. All right. There we go. We continue to have right around 67 people in our CCS program. That is down a little bit. Our referrals right after the first couple months after COVID went down to nothing. Now they're bouncing back up, somewhere between 8 and 12 a month. I don't know if you remember last fall and this winter before COVID, our referrals were running 16 to 22 a month. And so, which is very high for our program. So we do have we're still working with the referrals. We found that intakes are not working so well with telehealth. So we've gone to doing our intakes face-to-face. The vast majority of the services we're providing right now are outside social distancing with the face mask, which is hard to do when you're signing a lot of paperwork, but we're getting it down where we review the paper, put it down, step away, the other person steps up and sign it. We kind of got the signature dance going on. That seems to be going well. We're beginning to plan for the winter. When it's 40 below, we are not going to be outside social distancing. So we have set up 3 rooms within the downtown building that is going to be, they've got the plastic shields that you see at the grocery store. Staff all have various levels of PPE, all the way up to having an N95 mask, and disposable gowns, plastic shields, disposable gloves, the whole bit. Then all the way down, there's a protocol in place for what PPE you use when. Of course, hand washing is our number one, in all circumstances, is our number one thing that we are trying to do. Our staff are still, if you can work remotely, they are doing that. We have quite a bit more staff in the office right now because a lot of staff are feeling there are some things that are just more effective. We have some staff who live rurally, and internet just works better within the office. That being said, if things should go south in a hurry, all of our staff now are set up and could work, and they all have work they could do remotely from home. And that could happen immediately. One of the biggest things that have happened is that Headwaters, who provides the vast majority of our home and community skill-based services, gave us a 30-day notice. And so as of September 17th, which is this week, Headwaters is, we're going to lose a lot of capacity to provide services. And so we've been working very hard in the past couple weeks. One of our other providers, GT Independence, has stepped forward. They did interviews last week, and it looks like there will be 2 hires for the CCS program that will come out of that. That will certainly help, but we need more. That is one of the reasons why we're working with Northland College and WITC with interns. They'll be providing some of that direct service Headwaters was going to do, as well as they'll be helping out with our regular QA projects. We've talked to some of our existing providers, one who's providing certified peer specialists, to see if they would pick up some of this home and community work. I'll hear from them by the end of this week. I'm contacting other vendors to see if they will move into our region. One who works with youth in particular in central Minnesota in other CCSs. And then I have a lead on agency in Douglas County who might be interested as well that I'm following up with. So this is a huge, you know, I don't have to tell you folks this is a huge issue. A lot of these same people who had their services cut in May of 2019 are now going to have their services cut again. We are doing the same thing. Everybody will get something. Right now, service facilitators are working with their folks to prioritize what's an absolute need, what could be put on hold temporarily, and moving from that. Our service facilitators, our nurses, and our substance abuse folks are going to be doing more direct service in the meantime, especially for those areas in which the services are a priority. Martin Gordon was doing shared services with the Bayfield CCS as our substance abuse professional. Bayfield County has hired someone that can take over that function. And so Martin is choosing now to go to 3 days a week and into semi-retirement. He has been in the field, I don't know, somewhere between 30 and 40 years. He's been a great resource to Bayfield and Ashland counties over the years. And though he deserves to have a retirement as well. We have a new vendor that should be coming online. They will be providing parent peer specialists. So this is a new program that the state has implemented. There currently is no parent peer specialist certification, but the state is intending on that. They have already developed the training. And so these people have taken the training. But right now there just is no testing. You know, the testing has to be in person, and there's just no testing going on. We have applied for variances for both of our programs to Wisconsin Department of Quality Assurance related to providing services safely during a pandemic. There are some state statutes that we are not able to meet for in-person supervision in some things around signatures in informed consent, those kinds of things. So those variances are in place till the end of the year. Some of them ended at the end of July, but the ones we need to continue go to the end of the year. So our CSP census has gone down. We were working with Laura Compton to bring some of those folks home that are in placement, and for whatever reason, that's not working out right now. So our CSP staff are going to be helping out in CCS temporarily while we are trying to fill the void this losing Headwaters is creating. And by the time these folks are ready to come out of placement, we should have things in place where the CCS staff then can go back to their roles that they have had in CSP. That's it. Oh, one more thing. Oh, the biggest thing. So the CSP had their site visit. Actually, it was a virtual site visit for our recertification, and we were given the highest recertification level you can get with no deficiencies. So we are now certified for 2 years. Yay, yay team.
Wow. Good
That's
for
it.
you.
Any questions for Val? And we'll move on to economic support.
Good evening,
There's Melanie,
everyone.
I think you've been here before.
In economic support, we determine food share, Medicaid, childcare, and fuel assistance. And so a reporter had just asked us from the Daily Press about the effects of the emergency unemployment benefit ending in July. And so I just want to provide a little data on that information when it came to specific to Ashland County. And so when I was reviewing the numbers from 2019 and 2020, so it looks like in 2019, we averaged around 1,100 food share cases per month. And through 2020, the data is showing that we've actually increased our cases each month. In August, when that emergency pandemic unemployment benefit ended, the $600 a week ended, we've had our greatest impact on our cases, and we've had 1,301 cases. So that's an increase of approximately about 200 cases for Ashland County specifically. And so when it comes down to dollar amount, the state actually issued some emergency benefits so that people who were eligible for a food share benefit actually got the full maximum benefit amount for their household for each member. And so say if you're eligible for a food share and you got $16, you could actually get $194 for the maximum food share benefit. And so for the month of August of 2020, that benefit amount equated to $592,005. And so to comparison to July 2020, the month prior, we were only at $232,273. So that's a little information regarding the impact of that federal unemployment ending. So for food share benefits, that was an increase of the $260,000 increase. So that's just a little data about our food share program right now. For the WEAP program, we continue to process applications past the normal end date of our WEAP program. Our WEAP program usually ends on May 15th, 2020. However, the state extended that application date. So we're able to continue to process applications for 2020 WEAP season through September 30th, which is a good thing. So we increased approximately 100 more applications from May until currently. And we continue to reach out to people trying to get them to apply and get a benefit for the year 2020. Also for the WEAP, the Public Service Commission of Wisconsin extended the moratorium for all disconnects to October 1st. So usually that moratorium ends, ended in usually April, mid-April is when we usually ended that moratorium. And so they continue to extend that through June. They revoted again in August, and that has actually extended now out to October 1st. So our WEAP intake worker has actually reached out to Xcel Energy, and they do not plan to disconnect for this year. So because the moratorium begins again for our area in October of 2015. So the only known utility company that is disconnecting in this area may be Bayfield Electric. So, but we continue to work with those individuals and help with crisis payments as we can. And that's a kind of a good recap of just the food share benefits effect of the $600 unemployment benefit ending and the effects that we're seen on the COVID when it comes to our wheat program. Thank you.
Thanks, Melanie. Any questions? And we'll move on to child support. Kelly.
All right. Hi, everybody. So I was just going to give you a little update on the Wisconsin Act 95 that was enacted into law with an effective date of August 1st of 2020. This was one of the things that we signed, or I asked you all, and you all did sign a letter that we sent to legislature asking them to support, and it passed and it became effective August 1st. What this does for us is it provides us the use of an administrative subpoena to get genetic material from a genetic test to determine paternity. So in essence, if we get genetic test results of 99% or greater, that will result in a conclusive determination of paternity. So we don't have to necessarily have a court case. We don't have to bring it to court, which would save time in the courtroom and money from bringing it to court. Once we get the genetic test results and the results are 99% or higher, both parents are made aware of it. We send a letter. They have 15 days to object to it. And if they do object, then we do file a paternity action with the court and we then go to court. However, if they don't object to it, then it goes from our office right to the Department of Vital Records and updates the birth certificate and so on and so forth. So it's not appropriate for every case, but we definitely will use it when we can. The only thing we are running into a little bit, which we didn't know was going to happen, is all of our genetic samples that we take, which we have started doing genetic tests again in our office. It was put on hold a little while when COVID started. I'm the only one doing them in the office, just so we have one of us doing them, and a few of the staff weren't ready to do that yet. So, but we are back to doing them in our office. So the only thing is that with the administrative paternity, the test samples have to be obtained after August 1st, so of 2020. So a lot of our samples remain on file with LabCorp, which is who we use for genetic testing, and we just can reuse them for up to 7 years. So we have to get all those people back. It's all new tests, so we can't reuse a test. But it's still a great thing. We're glad it passed. We look forward to doing it, and it will definitely make things a little bit easier for certain cases. That's all I have on that.
Okay. Any questions for Kelly? And we'll move on to Youth Crisis Stabilization Facility update.
Okay, this is Terry Barningham again. Just to keep you up to date on where we're at, you recall we got over $100,000 worth of funding to start a children's crisis. It's a brand new certification for youth to help when they are experiencing a mental health crisis. We previously did have a children's crisis bed, but it was licensed as a foster home for medically fragile youth, and it just was not a good fit. So this is a brand new certification. It's a brand new facility with its own code. And we were awarded the money for startup costs. It has been a long and difficult journey, mostly because finding staff is extremely difficult. They have to have some experience with children. They need to be a bachelor's level in a health and human services or related field. very, very difficult to find in our area, especially when we have to provide 24-hour care. So we have a day shift and a night shift. The day shift, as you can imagine, is easier to fill than the night shift. But currently, Carol from Northland Counseling has hired 3 people, and a 4th resume and applicant was being interviewed today. I know who the person was, and I know she had very good references, so I'm hoping we may be finally fully staffed. We have to have all our staff on and trained and put on a roster before we can get certified. So it's kind of a lot of front end money with, you know, paying people when you don't have any income coming in, because we can't children certified. So we're moving forward on that. We're looking at some of the things in the budget being shifted around. The grant is up. We have to have everything basically expended by the end of September. So we only have two weeks left to do that. So we're kind of in crunch time, trying to get as much out of that grant as we can. A big, huge shout out to Northland Counseling for taking this on. As you can imagine, it's quite a process and somewhat of a risky investment, because you know you have to have a certain census to meet your overhead costs. So so good news, still moving slowly, but we are moving forward. So that's the update.
Okay, thanks, Terry. 2021 proposed meeting dates.
And that's me again. We usually meet the 3rd Wednesday of the month in February, April, June, September, and November. I would propose keeping that if that's acceptable to you, and keeping our time at 4:15 if that's acceptable to the board.
Anyone have any problems with those meeting dates and times? Then we will continue on that schedule.
Okay, thank you.
Next is the written materials, and we're not going to go through each one of those, but I think you can view those on your own and ask any questions that you might have of those. Any of the department managers want to stress anything in particular in their report?
Jenny is not with us right now, but she did enter some information on what is called the YASI. It's a youth assessment screening instrument. And the whole state of Wisconsin has moved to using one standard assessment tool. Prior to that, our agency had used what was called the COMPASS screening tool, and throughout various counties used various tools. So the Department of Children and Families moved forward saying, we're going to implement just one tool and standardize it for the state. There are 4 different phases in the rollout. We are in phase 3, and the kickoff is actually being held this month. Our materials should be coming sometime next week, and I will just forewarn you that it is not just an easy process of getting the training and jumping right in. It is a huge endeavor. Yet one more thing that our limited staff have been mandated to do without any extra funding or resources to help, you know, with the extra workload. But there's nothing we can do, so we'll make the best of it, move forward, and hopefully this will really help us assess what the youth's needs are and make sure that we're giving them really a very personalized individual care plan to get them back where they need to be. And this is for the youth justice kids specifically, so.
Any questions from anyone? We'll move on to board member updates and possible agenda items. Any board members have any requests or updates? Any other business? Doesn't appear that we have. Next meeting date is November 18th at 4:15. And I imagine we'll be determining whether we'll meet in person or continue to meet by Zoom.
Yep, the way it's looking, it'll probably be Zoom.
Yeah. Anything else that anyone has to bring up? Otherwise, we can ask for a motion to adjourn.
Move to adjourn.
Second.
Motion made and seconded to adjourn. All in favor?
Aye.
Aye.
Opposed? Motion carries. Thanks, everyone.
Thank
Thank you,
you.
guys.
Good
Stay
night.
safe.
Thanks,
Thank you
everybody.
all. Be safe out
Nice
there.
job. Nice job as usual, Clarence.
Thanks.
You're welcome.